Hi, my name's Tamara Ownsworth and I'm a clinical neuropsychologist and a chief investigator on the NHMRC CRE in brain injury recovery. And I'm here with Dr. Elizabeth Beadle, and together we're going to tell you a little bit about one of the major projects that's going on in the CRE. The project is looking at interventions for self-awareness and self-regulation skills, and we're looking at answering the question of whether people with severe traumatic brain injury benefit from making errors as they learn complex new tasks. And we're actually comparing the effectiveness of errorless learning and error-based learning. And one of the main outcome measures we're using is the cooking task, which is an ecological measure of executive functioning. Lizzie, can you tell us a little bit about the cooking task?
Yes, absolutely. So Tamara, I go into people's own homes and I get them to actually bake a chocolate cake for me. So we've actually set up the kitchen today to bake a chocolate cake with Kevin. So I've explained to Kevin already, and I'll just touch base with him and check and make sure he knows what he's doing. So Kevin, we've got all of your ingredients here that you might need. We've got all of the utensils over here.
Right.
So you're going to pretend and act as if you're alone. And do you have any questions for me?
No, that's good.
Excellent. All right. Let us know when you've finished.
Thank you.
Cheers.
Lizzie, how do people find the cooking task?
Well, Tamara, it really depends on the person. So often how used to or how good a cook they were before their injury impacts how they go. But it's also about the severity of the injury.
So you find that their performance varies according to their executive functioning?
Yes.
Which we also assess as part of a standard neuropsychological battery?
Absolutely. So what we're really looking at is the types of errors that people make. So for example, a lot of people crack too many eggs into the bowl, or they might show some unsafe behaviours. So for example, they might go to the oven without the oven mitts.
Oh dear. So it provides, do you think, a good indication of people's capacity to live independently?
Absolutely.
And some of the risks?
Absolutely.
Yeah, great. So in our particular project though, we're actually using the cooking task as a way of gauging skills generalisation. So meal preparation is part of the program, the intervention, but we don't specifically target the preparation of a chocolate cake. So we're using the cooking task to assess transfer of skills gained in therapy to other everyday situations. So the trial's continuing until middle of next year, and then the findings will hopefully be available within months of the trial completing. So please stay tuned.